In this scenario, I am playing a nurse who is having a conversation with another nurse, Sheila, about taking a lunch break, even though she has a patient scheduled for medication during that time. My coworker believes that being 30 minutes off schedule isn't going to make a big deal to the patient, but I think that the patient should be receiving it at the exact time the doctor prescribed it.
Hey Alexis, are you ready to head to the cafeteria for lunch? I'm so hungry. I haven't even eaten breakfast today.
Yes, I would love to grab something to eat. I just finished administering all of the prescribed medications to my patients, so I have some free time to get lunch. Are you caught up with all of your medications and charting?
Pretty much caught up on all of my patients. I have one patient that is scheduled for antibiotics in 15 minutes, but I really want to go eat now. She'll be fine if I am 30 minutes behind schedule.
Sheila, I really don't know if that is a good idea. The doctor said that she needs to take her medication at 11 a.m. or 11:30 a.m., so it should be done at 11:30 a.m. In the I'm right and you're wrong position, I'm right to follow the doctor's orders because it was ordered that the patient takes their antibiotic at 11:30. If they took it too early or too late, they would not be following the order, and it might mess with the patient's treatment. In the you're right and I'm wrong scenario position, Sheila is also correct in that it is okay to give the patient their antibiotic a little bit off schedule. If it is off by 30 minutes, it is not going to be detrimental to the patient. If it was pain medication, then that might be a different story. You might want to check to see if that patient is experiencing any pain and might need some relief before you head to lunch. Also, if the patient is on insulin and they're about to be served lunch, you might want to check on that. You want to make sure to administer that at the right time as well. Antibiotics are okay to be a little bit off with, so as long as it isn't too long, then as long as it isn't too long and as long as you don't forget to administer it. In the we're both right and we're both wrong scenario, we're both right in our arguments. I'm right because I want to follow the protocols set by the physician and make sure that I am on schedule with all of my medicines I administer to my patients. I don't want to fall behind or forget anything. Sheila's also right because it is okay if the patient takes an antibiotic 30 minutes after the scheduled time. It will not make a difference in the treatment and it will not be detrimental to the patient's health. We both are still doing our job and we both want to offer quality care to our patients. We can both be wrong as well. I am wrong for wanting to be perfectly on time and on schedule, where in real life not everything runs that smoothly. We all run behind schedule and may forget things. We can't be perfect, and I am wrong for thinking someone else should adhere strictly to the rules when sometimes time does not permit a person to do so. She is also wrong for putting her lunchtime and her needs before the needs of the patient. In the position, the issue isn't that important. After thinking about the entire situation, I've realized that it is not a big deal if the patient takes his antibiotics 30 minutes later than he is scheduled to. He only takes them 3 times a day, so that is every 8 hours. 30 minutes off will not make a difference. As long as Sheila doesn't forget to give him his medication, everything should be fine. In position 5, there is truth in all perspectives. There is truth to both of our perspectives. I respect Sheila and I trust that she is a good and reliable nurse. She takes good care of her patients and I shouldn't question how she treats them. Just because I am a stickler doesn't necessarily mean that everyone else should be too. I have accepted that thought and will keep that in mind for any future issues that may arise.